All right. Hi, everyone. I'll just wait for my slides to come up. Thank you. Thanks for that. Yes, so my name is Chantel. I'll be talking about the IPSN's training framework, and then I'm going to hand over to Alice to talk about the competencies framework at the end. So we're going to share this talk. So I guess just to start with a bit of context about where I come from and why I'm up here talking about an IPSN tool. So I'm from the Centre for Pathogen Genomics, which is in Melbourne, based at the Doherty Institute, and part of our work is really supporting both research and public health. And we have a training hub, and I guess that's where the work to develop the training framework sits. So the idea around connecting trainers and implementers globally was something that we discussed with IPSN before the Global Partners Forum in 2024. And it really came about because we as trainers were really interested in understanding what others were doing, particularly more broadly across the Asia-Pacific region where we work. We wanted to understand if the training that we were providing and delivering was best practice and how we could improve on our approaches, and then also how we could share resources, how we could stop reinventing the wheel, and I guess harmonise with other training initiatives. So how we did this, I guess, was, yes, we hosted a workshop in Bangkok last year alongside the Global Partners Forum, where we brought people together to really discuss those things. And I'm not going to go through, I guess, all of the outputs just because of time, but I guess some of the things that we really wanted to do and some of the recommendations that came out of that workshop were to develop a position paper. So the position paper is in draft and it's going to talk about the challenges and the opportunities with training in the current training landscape, as well as, I guess, the next steps on how we can harmonise. And some of those ideas were things like really understanding what training materials and resources are already available, and then possibly exploring how we might share those resources in a way and how IPSN might be able to enable that. We also spoke a lot about how we could connect trainers and implementers globally. So through communities of practice, through forums like this, and sessions around workforce training. And then I guess I'm really going to focus today on this idea of the best practice model for capacity building and training. So the best practice model has really kind of formed into what is the workforce training and competencies framework as part of the IPSN toolkit. So we call it a training and competencies framework, but there are actually kind of two frameworks that are kind of work together and are aligned. The training framework is very much focused on kind of how you would deliver the training for it to be sustainable. What are the considerations more broadly than just the immediate training program? Whereas the competencies framework, which Alice will talk about in a moment, is really guiding kind of the specific topics you need to cover and how do you know that you are hitting the mark and providing the people that you're training with the skills that they need to deliver. So I must say that the training framework is still in its early stages, and I'm going to present on the structure, but the details are yet to come. And I guess how we've come up with this structure is on that left-hand side, you can see a screenshot which is out of the WHO considerations for developing a genomic surveillance strategy document. And that's, kind of the process of how you would develop a strategy and all the components that go into a genomic surveillance system for public health. So, and then on the right-hand side is the training framework structure, where we've tried to kind of adapt the processes from the strategy into this, what the components of the training would need to be included in order to support the implementation of a strategy. So the components are things like governance and program design, lab workflows, bioinformatics analysis, reporting and communication, and public health integration and evaluation. And then around the outside of those components, or those kind of topic areas, are these core considerations. So how do you design training that is sustainable? What are the considerations? And some of the things that participants at the workshop came up with last year were things like, do you have strong engagement, and is it a co-design model with partners in country when you're developing the training? Teaching and learning, so what's the model to delivering training that is most impactful, and things like mentoring or peer-to-peer engagement and ongoing ongoing partnerships across trainers and implementers were really highlighted there. Assessment and credentialing, which is, I guess, thinking about how you can, one, as a trainer, assess that what you're doing is working, but then also that the topics that you're teaching are really being absorbed and being used. And then, of course, implementation. What are the, I guess, components or considerations about how the training will actually be implemented in country? And some of the ideas that came about were, understanding what the broader genomics literacy is and what the funding landscape is. So, as I've said, this is still in the development stages, and our next step is to establish a technical working group to support kind of further refining this structure and the content that will go under the structure, defining what the outputs are. So how can we turn this framework into a tool or a guidance that will be useful and that will support both trainers and implementers, and then a consultation plan. So I guess similar to the process with other tools in the IPSN toolkit, we would like to test this and make sure that it works and continue to refine it as we develop. And then I guess just to illustrate kind of, the IPSN has all these great slides, and I kind of adapted this one for the training framework. So for example, the persona is, if I'm a program manager and I've got, a project in place that is supporting implementation of genomics for public health, the numbers are, how you might usually go about designing and then delivering a training program, and then the round circles in green are how the framework might kind of integrate into the process. So for example, at the start, the framework would hopefully guide what you would aim for, how we might deliver it, and what are the considerations. And then as you go through kind of the competency or the capacity assessment, it would also help to guide what we have and what we don't have in terms of our technical capacity, as coming from a trainer angle. And hopefully then, through that, how you would connect with others who might provide additional resource or additional expertise that would make the training framework a little bit more robust. And then, of course, and I've put asterisks there where other IPSN tools would support bits of this process, but going back, assessing, reviewing and refining, and then sharing that knowledge and resources back to that idea of a broader training community of practice. So I will just hand over to Alice to talk about the competencies framework.
Thank you, Chantel. So I'll quickly give you a brief about the competence framework. So as Chantel mentioned, a lot of the training that needs to be developed needs to be underpinned by what you want people to be able to do, and then thinking about how you're going to design the materials or training that is relevant for them to be able to do their work. So here I'm just showing you some of the people that have been involved, substantially involved in this work. Some of them are here, including David Anson and Michelle. So we came about this, we developed this because we wanted to fill in a gap. So we are aware that a lot of people need training in genomics or bioinformatics, but it's not very clear what exactly people need, what levels or proficiency levels people need. So we have, we will be publishing a paper on this, on how we actually came about with this framework, but I'll just quickly say that at the time we realized that there wasn't really any clear sort of like guideline with that sort of like end-to-end pathogen genomics pipeline in mind, and so we decided to start developing one. So what we did is we built what we call a 360 competence framework, and I'll explain why. This 360 competence framework consists of 10 domain topics, and there are 60 topics in this framework. And we then mapped these topics across what you would call 6 levels of proficiency. In other words, divided into sort of, people that are able, if you're able to just have to recall some material, some information, or you're expected to be able to apply that information, or you're expected to create new workflows. So these are some of the levels that we have used: remember, understand, apply, analyze, evaluate, and create. And in this case, it means that you're able to, if you're able to self-determine what your self-rate where you are, you're then able to determine where you want to get to as an individual, and then use that to find the type of materials you need. So you might be at a level where you're able to sort of like recall genomic concepts, and you would be interested in being able to apply or analyze genomics, and this way you would be able to then identify what type of training you need. So this framework, consisting of this 10 domains, starting from biological concepts all the way to, through to technical topics, and also cross-cutting themes and topics that are more focused on how can you establish, for example, genomics capacity, and how can you train in pathogen genomics. They're all in there, and we have designed it in such a way that it's not prescriptive, it is adaptable. It gives you something to start thinking about how you're going to design your training. And it can be used across different countries, different contexts, and by learners and by trainers and anyone who's interested in developing training genomic skills. So this is just a quick brief of the tools that we've developed that constitute the toolkit. So we have a database that we've developed, and this database is the 360 database, so it has the 360 competencies. And it is currently saved on GitHub, and we have developed an app that is being used to operationalize this database. So in other words, so we can pull information as you need it. And we have also developed a guideline that you can use to, if you are interested in doing operationalizing this for yourself as well. So these are some of the applications that include, developing your curriculum, which is what everybody's interested in, workforce planning, conducting needs assessments for the learners or even as a trainer. And we have quite a lot of ongoing validation to get, and getting feedback from, we've been receiving feedback from different organizations. We've been working with the Africa CDC pathogen genomics curriculum that Nikki and her team have been developing, and also working with the UK HSA and other organizations to get them to validate or implement it and see how we can improve it. So looking ahead, this is a living resource, and so we're going to be working also with the IPSN to make it as part of the training toolkit and as a foundation for global workforce strengthening in genomics and public health. And we are collaborating with the Doherty, the Center for Pathogen Genomics, Doherty Institute, and hopefully it can be underpin the training implementation toolkit for the IPSN. So that is all I have to say, and thank you. So since I am chairing, I will continue. So thank you. So next is we're going to have Nikki Mulder, who will present on building capacity in pathogen surveillance, and she'll talk about insights and innovations from the PHA4GE Training Working Group. Thank you, Nikki.
Okay, thank you. So I'm going to be representing the PHA4GE Training and Workforce Development Group here. So I'm going to give a brief introduction to the working group and then talk about some of the work. So one of the main activities recently has been a training survey and doing a gap analysis on that. And then I'll talk a little bit about some of the other work some of the people in the group are doing that relates to standards, AI, etc., and then where we want to go in the future. So the working group aims to bring together a community of trainers and training organizers. And this is really to discuss best practices in training, to share experiences, and to learn from each other. We did have a whole lot of people signing up who I think thought this was going to be about how do I learn bioinformatics, and that happens at every one of our train-the-trainer courses. It's for trainers, not for trainees. It's nice to get the trainee perspective, but this is really for trainers to get to share experiences. So I co-chair this along with Alice and with Duncan McCannell, who's from the CDC. So I was surprised to see when I got the list, just for the stats here, that we actually have about 120 members. The surprise was because we've never had more than 10 people turn up on any monthly meeting. So I'm wondering what those others are doing. I hope you pop in occasionally. We've also decided to include members of the GenEpi project. That's an EDCTP3 kind of network. And they were going to form their own training working group. We decided to incorporate them into our working group as well. So as I say, we've got over 100 members across 34 countries. So we've got a lot of representation from the US and the UK, but we've also got many other countries. So we feel like we're truly as global as we can be. In the monthly meetings, we aim to share experiences, so people give talks about their training programs, and then we discuss specific topics and provide updates on these activities. So the main activities are some of the things that I'm going to talk about. So standard curriculum, talking about these competencies, trying to develop resources and guidelines. We've had conversations around fair training. How do you keep your training and your training materials fair? We have had also discussions. I know one of the working group wants to develop an SOP for how to start a National Public Health Institute for pathogen surveillance from scratch, and we can support on the how do you build the skills for that to happen. We've had discussions on accreditation, coming to the conclusion that it's very difficult to do accreditation and to make that as kind of globally applicable. And then we've also tried to collate existing training materials and training initiatives. And so this is some of the work that we've been doing in terms of a survey and an analysis of those to do a gap analysis. So we put out a survey from the working group. And this is available all the time, but we had a big push for a whole lot of people to fill this survey in. And this is to fill in information about courses that you run in pathogen surveillance. And it asks a huge number of different questions, and then we've actually got all the results summarized on our website so that you can sort by organization, or whether it's for public health or academia, what kind of training it is. And then Alice got a group together to think about how we can use the results of this, analyze the results, and actually look and to try to do a gap analysis and see where we can sort of fill those gaps. So this paper is pretty much just about ready to be submitted. It's about pathogen genomics training, mapping global needs, gaps, and opportunities, with a caveat that, of course, it's only about the courses that we know about that people have submitted, and there obviously are some other courses out there. But this has analyzed 81 courses from 17 different countries. And so the countries that have been represented, so these are countries that actually are the ones that organize the course, but the course may actually have been run in other countries as well. Of those, just over half of them are actually designed for academic users rather than public health, but there's still 46% that were for public health specifically. Just a few pointers about some of the results. So we have a big range of topics. Most of the courses, unsurprisingly, are in data analysis of bioinformatics, because I think we've already heard that that's a big need. In many cases, just over 58%, the course materials are actually available. So this really means that you don't have to go out and create your own materials, that you can actually go and access ones that already exist. And then we found that most of them were targeted to beginners or intermediates, very little advanced training. And then some were pathogen, most were pathogen agnostic, and then various ones that are on specific pathogens. So we've really done a deep dive into this, and Alice is actually going to give a much more detailed results analysis of this analysis in our working group meeting this afternoon. But just to let you know that we've also come, based on those, we've looked at the main gaps in training and pathogen surveillance for public health, and then tried to come up with recommendations that we'll provide in the paper. So what we're trying to do in the working group is think, how do we address these gaps? We can build a community of trainers, we can build these training guidelines, and we can look at accreditation and other mechanisms, things that we found were missing in the gap analysis. So we also looked at what do we have in terms of trainers. So people, one of the questions that actually came up recently was, okay, I need to do some training. We want to get a good gender equity in our trainers. Where do we find? We couldn't find female trainers. So we went back into our trainer database to look at this. So our trainer database has got, for people who want to say they're available or they want to support trainees through a help desk system. And we found again that a lot of these trainers were in bioinformatics, spread across the world, very high proportion of trainers in the US. In some countries, the mix of male and female trainers was approximately equal, half-half, but there's some countries where we only have male trainers in the database. So again, that's something I think we need to address, and maybe we can get some more female trainers involved. But it really helps when you're trying to do equity in training and make sure your training has a good gender balance in terms of the faculty. So some of the other topics that we've discussed is AI for training. We know that AI can be used for pretty much anything these days. So we've got a project that we're working with the Asia PGI and with Sanbi to look at benchmarking tools, AI tools for different areas of training, design, and development, all the way from course design, deciding on your course content once you've got a set of learning objectives, creating training materials, translating the training materials into different languages, mapping competencies to courses, etc. So there's AI can be used at any one of these levels, including creating the assessments. And so we're benchmarking these and going to create a guide for people who want to develop training using AI, which tool you should use, which one's best at different processes. And then the other thing we've been using it for is to try and think about how, when you get 2,000 applications for your 20-place course, how do you decide which are the best applicants? And so this is based on their job description, what are their current skills, what are the competencies they require, and will this course give them those competencies? And so we're building in this AI tool that can help you to go through that list of applicants and decide who's the best person. And then because we'll have all this information, then the learners can actually come in and assess themselves and say, well, I want to learn this skill, which is a course that I should do, which is a course that's going to give me the right competencies. And then, of course, PHA4GE is all about standards. So the PHA4GE Training Working Group is trying to think about how we can implement standards in training. So there's standardized course learning outcomes, standardized training materials, course assessments to really assess skills and knowledge. And then the competency framework that you've just heard about. So one of the ways we've been doing this, and Alice mentioned this, is we've had this project, and a lot of people in the room have contributed to this, to build a standard curriculum for pathogen surveillance for public health. So we've got these sets of, these are foundational modules in sort of generic ones for wet lab and dry lab, and then specific ones for bioinformatics and for wet lab, and then we've got pathogen-specific ones as well. And so for each of these sort of course sets, we've got a kind of collection of modules, and it shows you through the workflow of a pathogen surveillance lab, which modules cover which area. And then within each module, it provides information. So it's all very well to say these are the learning outcomes, but there's different depths that you can go into. You can run a 2-hour course, or you can run a 5-day course on the same topic. And this is the curriculum's trying to tell you what depth you should go into for a specific person, a specific audience who wants a specific set of skills and competencies at the end. So it gives you indicative content, it gives you the learning outcomes, and then we've also developed a whole lot of assessments using AI in many cases that are on the ASLM platform, so you can actually go in and say, well, actually I did gain those skills, or I did gain the knowledge, and there's a practical skills assessment as well. So those are some of the standards, and we have a competency session tomorrow after lunch. So if anyone wants to come and see curriculum session, if anyone wants to come and see what's happened with the curriculum, how you can contribute, what the next steps in terms of mapping it to Alice's competencies, and where we need to go creating course materials so that people can actually pick up course materials, and of course alignment with the other programs, then come to that. But there are many other things that we're planning, so we want to put all this together. We've got all these pieces. How can we put this together so that a public health staff member can come and say, what skills or competencies do I need to do my job properly? What are the modules or courses that will give me those skills? How do I assess that? So can I just do a quick test to check that I have those skills already in an online assessment? And then think about accreditation as well. And we've also been asked whether this set of courses, the curriculum, can actually be developed into degree programs as well. And then, so that's putting that all together. We also want to think about what the training needs are from the other working groups. We know that there's sysadmin training that's required. Some of the groups are working on wastewater surveillance curriculum and training. How do we support them? There are also other outputs, so the data standards, for example, from the data standards group, they are actually all incorporated already into the modules. So we specifically say you need to teach these PHA4GE standards. The pipelines, when we develop the pathogen-specific courses, you pick 1 or 2 pipelines that people have used. But actually, if the working groups already said, benchmark these, and this is the right pipeline, then it's much easier to target the training content to that PHA4GE-approved pipeline. So we want to do that, and then we also want to align with related activities. So we've just heard about the IPSN activities, there's GF4GH, there's Global Bioinformatics Education Summits. There's a lot of stuff happening out there in terms of supporting trainers and and training organizers that we will build on rather than reinvent the wheel. And also thinking about how we can do tracking and tracking impact and metrics for training and support that across the community as well. And so if you want to get involved, you can join the working group, add to those 124 people, but please turn up at the meetings, that would be fun. Contribute to the activities, so sometimes we have activities, you can actually step in just as a guest speaker, talk about your activities, and tell us about what you need or what you would like from the working group. So I'd like to acknowledge the other co-chairs, all the members, the PHA4GE Secretariat for their support, and then the funders, the Gates Foundation and the CZR have supported some of our activities as well. Thank you.
Thank you, Nikki. It was interesting to learn about how far the curriculum has come. All right, so our next speaker is Keaghan Brown, and he'll share his insights into integrating multiple learning strategies for public health in wastewater surveillance bioinformatics.
Hi, everyone. Thank you very much for the opportunity to present in front of you all today. I would like to share a very exciting initiative with you guys from the PHA4GE on how we are integrating multiple learning strategies into our wastewater surveillance bioinformatics course. So the pandemic, though not too recent, highlighted the specific need for bioinformatics in public health response and the urgent need for practical tools and training beyond the academic space. Wastewater monitoring provided an opportunity and proved to be highly effective in acting as an early warning system during the pandemic, helping us identify the presence of pathogens before the presentation of clinical cases. Expanding the capability to a global aspect, especially in under-resourced settings, proved very important, just not in the aspect of sampling of the wastewater as well as the sequencing of the wastewater, but the implementation and the development of bioinformatics skills to process, analyze, as well as report a complex variety of data sets. So PHA's role in the development of this course is very crucial because we decided to shape it to be highly impactful and highly practical. We decided to draw on a variety of domain experts to help design a very hands-on, very interactive, as well as implement real-world data sets to ensure that the overall wastewater surveillance course was incredibly effective for the people who were participating in it. We also decided to take the approach of implementing a variety of learning strategies, so specifically text-based documents, lectures, audio files, dashboards, as well as game-based learning, so that learners with a variety of learning styles can actually effectively engage with the course as a whole. So, as we were busy designing this course, we decided to make it modular and balanced. We decided to start with some of the foundational concepts within wastewater surveillance, such as the impact of wastewater surveillance in public health, wastewater collection and sampling, as well as the downstream wet lab analyses and methods that are conducted on those samples. Once we were confident that the participants had managed to establish the foundational concepts necessary, we decided to then move them on towards a more hands-on approach of data processing, quality control, lineage determination, and then generating the necessary data plots and reports to the various stakeholders that were required. We specifically decided to take a hands-on approach because we believe that this helps mirror real-world scenarios and public health challenges, allowing learners to actually fully implement and integrate the pipelines and make the respective decisions based on their needs. This particularly ensures that the bioinformatics component of wastewater surveillance is not only understandable, but actionable as well. So specifically with regards to the integrated learning approaches, we understand that various learners learn in different styles. Some learners may prefer text-based formats where they read through documents and lessons. Other learners may prefer hands-on video lectures where they actually get to hear directly from a subject matter expert or lecturer. Others prefer some sort of auditory interaction, so a common one that we have come across is podcasts, while other people are kinesthetic or very hands-on and prefer very interactive sessions. So we decided that with this particular course, we would actually integrate all four of these approaches, and one of our favorite ways in actually ensuring that the teaching was interactive was by creating a storyline/game-based approach, in which the participants actually follow an avatar in the form of a bioinformatician as they tackle real-world bioinformatics analyses and wastewater surveillance challenges. Each module that we have set up in this course makes the learning extremely immersive and meaningful, but at the same time ensures that all of them are memorable so that they can actually build the skills necessary from the foundational concepts all the way to the more intermediate and advanced ideas. Oops. Our instructional design specifically decided to use one of three different frameworks. So we decided to implement the pedagogy approach, which involves direct instruction for core concepts, such as those that we applied within the command line interface module. On top of that, we decided to implement andragogy, which focuses more on peer-based interaction, where you use real-life case studies or scenarios in order to understand exactly how to communicate effectively with others as well as the instructor themselves. Lastly, we decided to use heutagogy, which is more of a self-directed learning through a capstone project. So with this particular capstone project, we decided to let the participants of the course actually build or implement the pipeline itself and build a wastewater surveillance dashboard, choosing their own data sets, tools, and their own visualizations that they would actually like to report on. The reason why we decided to implement this capstone project was because, as I mentioned earlier, it mirrors the real-world complexity of wastewater surveillance. There is no single right way to report this information. There are only the things that we can teach them what to show or what to make decisions on, and then implement those for their own respective needs. So this particular course is one step in a broader effort to actually build capacity, collaboration, and a data-driven workforce. The next public health crisis is not a case of if, but when specifically. And bioinformatics is no longer a niche field in the public health space. It is a necessary key skill that needs to be made understandable but usable for everyone, and making it even more extremely essential. So over here you can see the participants that we have had for the pre-workshop conference that we had. where we chose and isolated some of the key modules from our particular course and decided to implement it in a pilot situation. And the feedback from this particular course was extremely positive. I would just like to acknowledge all the subject matter experts and organizations that were involved in developing this course, and for the Bill and Melinda Gates Foundation for helping establish it. Thank you very much.
Thanks, Keaghan. It was really good to see how you're making these materials more engaging and accessible, and I think this is something that we all can benefit from, just the style and the way it's been structured. That was quite interesting. Next we have Gladys Ibrahim, who will speak on scaling genomic workforce capacity in Africa through youth-driven solutions. Welcome.
Good afternoon, everyone. Thank you so much for the opportunity to speak here today. I'm immensely honored to be speaking to this room. So my name is Gladys. I am from Nigeria, and I'm the founder of the Consortium of Genomic Students and Young Researchers in Africa. And this afternoon, I'll be talking about why it is very important for us to have youth-driven solutions and models towards scaling genomic workforce capacity in Africa. Of course, my presentation is going to be a little less technical than all the things that we've been hearing since yesterday. So to start with, I will start with a statement that I'm sure all of us in this room are very familiar with, which is that Africa is the most genetically diverse set of people. And there are a number of things that have been attributed to this fact, some of which include our complex population history, dramatic variation in climate and diet. I mean, just conversing with people across this room, you can see how we vary so much, but we're the same, but then we differ in terms of our weather, things that we eat, and then some of it has been attributed to our exposure to infectious disease, and all of these things together contribute to the high levels of genetic and phenotypic variation that we have in Africa. Now, we need to, despite being the most genetically diverse set of people, we are still one of the most underrepresented in global genetic databases. And we need to ask ourselves why. What is driving Africa's underrepresentation? There are a number of things that can be attributed to this fact, but some of them are things that we already know, which include things like structural and funding gaps, governance and trust issues. But I will dwell on the workforce and capacity challenges that we have, which is probably which is what I'm passionate about, and which is what CoGSAYR tries to do or tries to address. So we're going to be looking at the workforce gap, and we'll be looking at it from two angles. We'll be thinking about what it is and what it is not. So I'll start with what it is not. The workforce gap is not fueled by a lack of interest. And why do I know this? And why am I so confident in it? I'll give a bit of a background as to who I am. So I'm a medical doctor, and I developed interest in genomics, particularly pathogen genomics, and just like the intersection between pathogenomics and human genomics, and why it is important for us to actually design research in ways that actually translate to the bedside. So, of course, while I was in medical school, I had this interest which was growing, but I still had my books to read, very big books to read, but I wanted to learn some things about genomics, and I was trying to look for communities where I could connect with people like myself, young people like myself who were interested in genomics. I wanted to learn and grow together because I had limited time, so I needed that peer support. And I tried to find things like that, and I did not find any. And so when I finished medical school, which was about a year ago, I sat down somewhere in my room, put together a 2-page concept note somewhere in my room in Kaduna State. I don't know how many of us are familiar with Nigeria, but somewhere in northern parts of Nigeria. And I put together these concept notes and I put it out. Essentially, I was calling for people who were interested in genomics but did not know how to go about it and were young. And I put it to be people within their penultimate and final, people in their penultimate and final year, and within first 5 years of graduation. And when I put out this call, it was amazing to see the number of people that actually were interested. We got applications from up to 11 African countries, and these applications were close to 400, and I was astounded. So this suggests that definitely young people are interested in this. They are looking for communities where they can connect with people like themselves and learn together. So we know what it is not, so what exactly is driving this workforce gap? There's quite a number of things. There's infrastructure disparities, there's limited mentorship, because there's only so many people that these mentors can take under their wings, and we have lack of accessible training opportunities. It was actually interesting to see some of the training opportunities that have been put together, some of the resources that people actually do not know about. So we can see that the missing link here is structure. We have high interest among young Africans, but little structured foundational support, because a lot of our schools don't really give us the basics, the things that we need to thrive in these spaces. If not because of some of the things I've exposed myself to because of my interest, I can't sit down in this room and actually understand what people are saying or are talking about. So we need this structured foundational support to actually bridge that gap. So what is this organization and what do we do at CoGSAYR? I'm going to call it CoGSAYR because I know the name is a mouthful. So CoGSAYR Africa is how we call it. CoGSAYR is a youth-led initiative which is aimed at addressing this gap, so the African genetic data gap, by encouraging, one, enthusiasm, and two, involvement among young people in genomic research. So what is the CoGSAYR model? So I know a lot of us in this room are particular about pathogen genomics, but CoGSAYR actually cuts across both human and pathogen genomics. We have 5 major interest groups, and we kind of mobilized our members into these 5 interest groups, and these were thematic areas or areas in which genomics is being applied, and things that may be of interest to these people. And these include cancer, infectious disease, neurogenomics, epigenomics, and global health genomics. And we wanted to just introduce them to the basics of genomics, because when they're able to understand this, they can actually apply it to their various fields of interest. And then we started with what we had and what we could control. So, of course, it's one thing to sit down and complain, or we don't have access, we don't have the knowledge, but what really can we do with what we have? What we had was community, and what we could control is access to research papers that are out there. So we tasked these groups with coming up with topics of interest, and we told them to carry out literature reviews, systematic reviews, and essentially critically appraise works that already exist, and put them together, synthesize them, and present them at the end of each month. So we do what we call general assemblies, which are like monthly presentations where these people present what they've learned over the course of their literature reviews. And sometimes they even invite experts to provide expert insights on things that they don't understand or their perspectives. And that's what we've really been doing for the past 1 year. So while preparing for this presentation, I had to pause and ask myself, in the last 1 year, what impact have we really had on these people who we have taken on as members? Of course, those we could take because we couldn't take everybody. And just pausing to ask them some questions and asking them what the most valuable support that this organization has provided to them. And the ones that really stood out included peer mentorship and collaboration opportunities. And we actually had about 67% of the people who filled the survey say that they have experienced significant improvement in their confidence in genomics. These are people who never understood what genomics was about. They saw it as something that was far-fetched, but then now they could contribute in conversations, they could listen to talks, they could read research papers and actually understand what it meant, what the research methodologies and the terms meant. Some skills that were developed included teamwork, collaboration, scientific writing, and we had a number of people who actually carried on new research projects. Some received peer support for ongoing research, and some people actually had their research interest and career interest refined. These were people that really did not know how to apply genomics or what the intersection was between genomics and what they were interested in, but now they have had their research interest refined. So I picked out a few stories which stood out for me from this survey, and we can see a number of real stories from real people. One here says, the group discussions and my involvement in the presentation allowed me to refine my research interest around antimicrobial resistance and genomic vaccinology. We have somebody here who said, I am now more committed to advancing knowledge on how genomic data can tailor preventive health interventions for vulnerable populations, aligning with my larger One Health advocacy and public health research pursuits. And one here, which I particularly love, which says, CoGSAYR has given me the platform and the right people to collaborate with while doing what I love. So what are we looking forward to? What we really wanted to do in the first year was to build this community and to establish this community, which we have now done. We have people from all over the continent who keep on messaging us on LinkedIn, how can I join, how can I join? So we have the community, we have the exposure now. So what we're trying to do is to deepen our roots, to provide roadmaps, practical roadmaps on how to translate these people from just interest to knowledge, to provide basic genomics education and basic genomics opportunities for them to learn what genomics is about and how they can apply this, and really just see how they can use this to innovate. There are so many ways in which genomics can be applied to innovate, coming up with vaccines and so many things, and just see what they do with this education. So what we are not is definitely not genomics experts, but what we have is a community, and that's our biggest resource. We are driven by passion and peer mentorship, and what we are trying to do is hold space for young genomics enthusiasts who have little to no access to organized genomics education. And communities like this, looking forward, are things that people can leverage on. I mean, I know there are a lot of people who are looking for ways to invest in the African population. This offers funders and partners a cost-effective way to make real impacts, because then they are able to leverage on this community that we have already formed. And one thing that I really want us to take is that we need youth-driven models to actually drive the change that we want, because we, the young people, we bring the energy, and we have so many bright ideas, and all we need is the resources. Thank you so much.
I hope all of us can get a cue on that energy, and if we had all that energy, we could convince all the young researchers to get into genomics. Okay, so thank you very much, Gladys. Our next speaker is Oliver de Sousa, who will introduce an AI chatbot to support pathogen genomics trainees. Welcome.
Hello, everybody. I thought that there was going to be a presentation thing here, but that's all good. I'm here to, oh, there we go. Today, I'll be sharing my project, an AI-powered chatbot for pathogen genomics, education, and support. In short, this work explores how AI can be used to make genomics education more accessible, responsive, and scalable. To start with the challenge, the why. Pathogen genomics is a rapidly growing field and essential for outbreak tracking and understanding how diseases spread. But the reality is that specialized training and expertise in this field are still limited, especially across resource-constrained regions. Even after formal training, many learners still struggle to apply theoretical concepts to real genomic workflows. The NGS Academy Help Desk provides a help desk, but this help desk relies on human and manual control, and with increased number of people, more queries, more buildup of unanswered queries. So the solution, I've been working on an AI-powered chatbot, which provides real-time support to genomic learners. To achieve that, I set out 4 key objectives. First, to collect and curate a high-quality literature corpus. Second, to build a semantic knowledge base that understands meaning, not just keywords. Third, I want to integrate it into the help desk. And fourth, to collect feedback for continuous improvement. Methods. So we get the data, we clean it, we extract it, we embed the data, and we index and design the retrieval mechanism. So, simplified overview. We started by downloading and cleaning full-text articles from PubMed Central, utilizing their FTP. These articles were processed and cleaned. After cleaning, I divided the data set into thematic categories, things like pathogen genomics, NGS, and phylogenetics, based on their keywords. Each data set was then converted into semantic embeddings, which is a numerical representation that captures the meaning of the words, and rather than just keywords. So the chatbot uses what is called a RAG pipeline, which stands for Retrieval Augmented Generation. So when a user submits a question, the system searches the index for the most relevant text. It then passes that context plus the embedded question to a language model, and then generates an answer grounded in that retrieved information. So this helps reduce hallucinations and improve accuracy, because the response is based on the actual retrieved content and not actually on what the model is trained on. So then I wanted to design a chatbot interface that is simple and intuitive. Users can type the question, see the answer, press a feedback button, that answer, and that question is then stored in a log file, and we can use the unhelpful and helpful ones in the future to improve the general chatbot. And then, importantly, it also provides the source context, so which papers it used, what title of those papers, the PubMed Central IDs of those papers, so that learners can go and follow and check out those papers and see for themselves if the answer is bogus or not. So the results. To evaluate the system, I tested the chatbot on category-specific question and answer datasets. I focused on 3 metrics: retrieval accuracy, generation quality, and response latency. Exactly how it finds the information, how accurately it answers it, and how fast it responds. There were 2 scoring mechanisms that I've used so far, the BERT F1 score and the Rouge L score. BERT F1 measures how well the answer captures the meaning from the question, and then the Rouge L checks whether the chatbot has copied what the answer is. So this is an example. The question asked about transparency in animal experiment approvals. The chatbot's answer captured the same ideas as the human written reference, discussing public understanding, ethical oversight, and publishing rationale, but in its own words. So across all 5 knowledge bases, the chatbot achieved an average BERT F1 score of around 0.84. That's considered a strong level of semantic alignment, meaning that the chatbot reliably understands and reproduces the intended meaning of the scientific context. The Rouge L score averaged about 0.12, which may sound low, but this is exactly what we want here. It means the chatbot doesn't rely on copying phrases from the literature. Instead, it paraphrases. Together, these 2 metrics, high BERT and low Rouge, show that the model understands, interprets, and rephrases complex ideas effectively. In terms of efficiency, the system generated responses in roughly about 2 minutes on my local hardware. The response times are longer than ideal, but that's expected given the constraints of running locally on my laptop. The encouraging part is that the pipeline will scale well, meaning that on an HPC or cloud infrastructure, these times would be reduced. When we look across all categories, the chatbot achieved a success rate of around 94%, meaning nearly every answer reached the high semantic accuracy threshold, which is BERT score greater than 0.8. It's performing well as a prototype, though there's still room to improve the retrieval precision and handle out-of-scope queries more gracefully. The next stage would be the user testing, so I'd be running a pilot study with trainees and researchers, gathering their feedback and using that to improve the interface and the underlying retrieval mechanisms. The step is essential because even the best performing model needs real user data to become genuinely effective in an educational setting. So, in conclusion, what have we achieved? What does it mean? What's next? So we've developed this RAG chatbot trained on open access pathogen genomics literature, showing high semantic accuracy across multiple categories so far. Early results suggest that it can synthesize and explain complex bioinformatics concepts in real time, hopefully helping learners work more independently. Further work will still focus on improving retrieval, expanding the data sources, and adding multilingual support. Thank you. Yeah.
Thank you, Oliver. So finally, we hear from Julia Pringle of the Association of Public Health Laboratories, and she'll be presenting the tabletop exercises, a tool to facilitate collaboration between laboratorians and epidemiologists working in genomic epidemiology.
Okay, good afternoon, everyone. Thank you so much for the opportunity to be here and to be part of this session. It's been a really great session so far. And I don't have any conflicts of interest, just want to say that up front. I am going to be talking a little bit today about my experience working in workforce development. So first I want to tell you a little bit about what that lens is. I work for APHL, the Association of Public Health Laboratories. We're a US-based NGO comprised of members from US public health labs, environmental labs, and agricultural labs. At both the domestic and the global level, our main objective is promoting laboratory system strengthening. And we do this with a mix of capacity building activities, technical assistance, et cetera. We have offices in 12 countries around the world, and we also work in additional countries beyond that. And at our global health team level, we have expertise in a wide range of topics, things like quality management systems, biosecurity, just to name a few. But I am specifically on our global health, NGS, and bioinformatics team. The name speaks for itself. My team focuses on sequencing, including the generation and the application of sequencing data. So I probably don't need to tell the whole room this, but something that has been really clear in my team's work over the years is that the COVID-19 pandemic was a major catalyst for expanding the capacity of sequencing around the world. You can see that in this figure, which is already very outdated, but the blue bars are showing the number of countries in every WHO region around the world with sequencing capacity in 2021. The orange is 2022. We know that it's expanded across the globe. And that's a great thing because we all know that genomics has the potential to answer some really important public health questions, not limited to transmission, outbreak, investigations, AMR, et cetera. However, sequencing and bioinformatics is really only part of the equation. This framework reminds us that impactful data really has to be integrated with other components. Specifically, we've heard a lot about metadata so far in this conference, but that's really key. Data alone isn't necessarily meaningful. It has to be linked, it has to be reported, it has to be correctly interpreted. And it really should lead to a public health response. That's the goal here. And finally, what I really like about this particular framework is that it's not just one line in one direction, but it's really reflecting the cyclical nature of this whole pipeline. It's really decisions, the decision of when to sequence, what to sequence, how many samples to sequence. It should be guided from the start with those public health relevant questions. In the context of the COVID-19 emergency response, rightfully so, we focused a lot on the left-hand side of this framework, and that makes sense. That's what we needed to focus on at the time. That focus was largely on laboratorians and bioinformaticians, and it largely excluded epidemiologists and sometimes public health decision makers. A lot of those capacity building activities were effective in increasing the amount of data generated. You can see in this figure in blue the number of SARS-CoV-2 genomes uploaded each month to GSAYR. The top is globally and the bottom is broken down by high, middle, and low income countries. So clearly we had some success in generating the sequencing data and uploading it to databases. However, I really like this quote by Bill PHA4GE, former US CDC director. He says the reason for collecting, analyzing, and disseminating information on a disease is to control that disease. Collection and analysis should not be allowed to consume resources if action does not follow. So I think the question that remains here is, to what extent are we utilizing all of the genomes that we're sequencing to further public health? And clearly, the answer is yes, we're doing a great job in some case studies. I'm sure we're all familiar. We've heard a lot of them reflected in this conference so far. Outbreak investigations, food recalls, et cetera. We know that there are specific examples of when this is really well done. But I think there are also examples of when sequencing just occurs and isn't necessarily used to its fullest extent. In this current climate and political world that we're in, I think it really is important to think about how we can improve that aspect. And even without having a quantitative study about how well we do at this, I can anecdotally reflect on some of the things I see. And one of those is a major gap, a major silo between lab and epi. I think this is true around the world. It's definitely true in the US. It's true in a lot of places that I work. And this is evident by the responses I get when I ask labs something like, so what happens with the data after you generate and analyze it? And I've heard things like, we share the report with epi, but we don't know what they do with it. Or, we've never heard back. Or, I don't think they know how to interpret it, but they've never asked us. Or just, that's outside our scope. Clearly, this is a problem that has the potential to reduce the actionability of sequencing data. And as we move into our next phase of workforce development activities, I think it's going to be really critical to address this whole cyclical continuum, including epidemiologists, including decision makers, expanding beyond laboratorians and bioinformaticians and focus on this whole system. So there's a lot of valuable approaches. There's not just going to be one perfect puzzle piece that solves all of this reducing silos. It's going to be a mix and it will look different everywhere. But one thing that I want to share that has been helpful in my work so far is the role of tabletop exercises as a method to bring these two teams together, introduce them to each other, and demonstrate that together they have the skills to solve complex problems. So in 2024, my team developed a mock outbreak tabletop exercise, and we've since led tabletops in Honduras, Paraguay, and Guatemala. Next week, we have another one planned, although that one's a wastewater-focused one, for regional training in Zambia. The specific foodborne outbreak investigation that we developed, it walks participants through all the steps in an outbreak response, starting with a fake email from a hospital physician reporting a suspected outbreak. Participants together have to confirm the outbreak, identify more cases. They go through a food history questionnaire. They conduct a case control study. They interpret odds ratios. But really the crux here is that it requires sequencing to really yield anything, some important results. Specifically, at the first pass of the case control study, there's no significant association between any food and the outcome of having listeria. It requires looking at the sequencing data to identify that there is a cluster of genetically related isolates and also some other ones that are just red herrings and not related to the outbreak at all. So it's that process of integrating the genomic data, reanalyzing the case control study, that finally leads to solving the outbreak. Throughout the exercise, participants work in small groups comprised of both lab and epi staff. It encourages them to build relationships with each other, and in my experience, that has sometimes been for the first time that they're meeting. The critical takeaway for everyone is that neither epi nor lab have all the information by themselves to solve the outbreak, but together they're better than the sum of their parts. And in addition, it just helps build a common language. Laboratorians are exposed to what epi methods include, and epidemiologists are exposed to what sequencing can answer, what that timeline looks like, and most importantly, how methods like sequencing, phylogenetics actually complement traditional epi methods and should be used together. So in the tabletops we've led so far, participants have self-reported things like appreciation for the skills of their counterparts, gratitude for meeting each other, sometimes for the first time, and this new understanding of how epi-lab collaboration is ongoing. It's more than just a one-time report handoff, it's an ongoing dialogue. And finally, an understanding and a practical experience of what it looks like to use genomic data collaboratively in the context of an outbreak. So in summary, we're entering this next era of workforce development where so many gains have been made in the last 5 years. Many of my colleagues presented before me have already acknowledged the fact that we need to start thinking about things besides lectures, besides just curriculum. And I would expand on that and say we need to think about other audiences to include groups like epidemiologists, policy decision makers, because it requires that whole community to really be successful at genomic epidemiology. Finally, I think I would love to share resources and also hear from everybody about what strategies have worked for you in reducing those silos. I think there's going to be a lot of things that work, and I think it could be really, really helpful if this community also shared those sorts of anecdotes going forward. So thanks for your time. Here's my email address. Feel free to reach out.
Thank you. Yes. If the presenters could come to the stage. Thank you, Julia. This was actually one of the questions that we are going to be covering in the working group. So if you could join the working group this afternoon, that would be great. Okay, so I might join you there, but I just wanted to say thank you to all the presenters. We've heard them reflect and present on workforce development initiatives, from competency frameworks to training frameworks, structured curricula, developing like creative models to engage participants, youth-led initiatives to increase knowledge and skills among young scientists, digital support systems, and also collaborative learning approaches. So with that, before I open up the floor to the floor for questions, I have one question, and any of you can answer. And I think this is the question that everybody always asks: how can we work together? So most of us, in fact, this is also one of the outcomes or findings from the meeting we had last year in Bangkok with Chantel and in the training workshop that we did last year. We all want to familiarize with what is there and how can we improve that sharing of information and collaboration. We have different organizations that are all interested in doing the same thing. We have the IPSN, we have all these different global programs, we have the PHA4GE, we have NGS Academy, we have quite a lot of organizations, institutes, projects that are, have the same objective, which is to develop skills, to develop the workforce. So my question to you is how do you think we can improve, and how can we better connect amongst these programs?
Go first? Yeah, I can give it a go. So one of the things we've done in the bioinformatics, not public health, but specifically in bioinformatics, is we organically created this Global Bioinformatics Education Summit. So it was because in our group we were thinking, we just really need to get these training resources done. Let's just bring trainers together, put them in a room, don't let them give talks, just let them work. And that started in Cape Town, and then it continued. And we got different organizations together, and even though they were all working on their own things, when they got into that room once a year for a week, they just worked on joint things and heard about each other's stuff. And then we actually have a monthly update, bi-monthly update meeting. So maybe something like that in this space, where you're not stifling what each group is doing, because I think each group is doing their own thing, as long as they connect regularly, because the last thing we want is yet another meeting where 90% of the people don't turn up. So I think we need to have these kind of connecting points, and maybe it's something similar to the Global Bioinformatics Education Summit, where you literally arrive in a place and you just work. You don't give presentations, you just work. And that really worked for us.
I think I want to add to that. I think we have a lot of tools, but we do not have people who are actually connecting the tools to the people, which is why I think it's very important for us to actually try to reach out to communities that already have these people within their communities and try to direct these tools to them so that they can have access to it and know that they exist.
I guess just to add to that, and I'd really like Nikki's idea about, you know, finding opportunities to connect, and that idea of coming together and really being able to work together as opposed to just listen to presentations. I guess one of the things that came out of the workshop last year in Bangkok as well was kind of in between those in-person meetings, which are obviously, you know, rare and expensive and few and far between, how can we create an online community? And the issue with these things is always who's going to coordinate it, where is it going to be hosted? And I guess one of the ideas that was, I think, quite well received at that workshop was this idea of, for example, through the IPSN and through the collaboratory, being able to create a kind of a training shared space where if you wanted to share your resources, you could, or if you wanted to just put up a list of what your expertise is, what the training modules you've developed are, and a contact detail like that would also be fine. So I think having those kind of online connections as well as an in-person forum.
Thank you. All right, so I'm going to open to the floor for questions. We have a question over there.
Hi, this should be a quick one. Oliver, I was wondering if there's anywhere I could download the model and give it a go. I've got access to big GPUs, so.
It's currently on my private GitHub. It is, right now it is all private, but it will be once it's done and ready to be put into the help desk. I'm sure I will make it fully accessible. Yeah.
Thank you. Any other questions for the presenters?
Yeah, my question goes to Julia. I sort of link back your presentation to what Karen commented about previously, where there's some informal relationships that aid information sharing. But in your situation where you're proposing like the tabletop exercises, which I believe is really excellent, but when I look at it, it's more reinforcing relationships that may be already existing. Like sometimes epidemiologists and people in the lab probably are people who share a common background, for instance, schools, and probably there are mechanisms under which they are really talking, but still things aren't happening. So what would be your opinion on actually having frameworks that actually do guide exactly how such people can work together to have sort of interpretation and analysis done like unanimously?
Yeah, thanks so much for the question. I think you're just really hitting the nail on the head with the question, because I think, it is frameworks that we need to share, and it's ideas that we need to share in this particular problem space. In other problem spaces, it is an SOP, or it is a bioinformatics pipeline, or something of that nature. But here, the solution will look different for everyone. And so I think it is just ideas. It's something like, well, we embedded an epidemiologist in the lab for 3 days a week. I've heard that as a solution that's worked for people. Or maybe it's tabletop exercises, or maybe it's we physically relocated, our buildings were on different campuses and we put them on the same campus and we have like a joint lunch every week or something like that. I think it could also be, what is a question I don't know, some sort of like dialogue facilitation guide that a trainer could give or something like that. So I think this is a space where the goal isn't necessarily a prescriptive protocol or a one-size-fits-all solution. It's, you know, what strategies worked, just so we could have a menu of options out there. And so I think you're right, it's a framework or just a menu of choices.
Yep, I think that goes back to, you know, some of the plans to develop these frameworks or training framework, competence framework. So perhaps having a place where you can compile all these tools and how people can use them would be useful. Okay. More question?
Okay, thank you. This is Bacha from Ethiopian Public Health Institute. So my question is for Gladys. Really, I appreciate your presentation, really, which inspires me as a young Africa researcher, especially I focus on malaria. So I do have two questions for you. The first one is how to integrate this initiative into like governmental health system or like just decision makers like that, how we can integrate, how you plan to integrate this into the system first. The second is how can I join personally this group? Thank you so much.
Okay, thank you so much for the question. I think the first one, what we're trying to do first was establish the community and build this community. But then asking a question about integrating into government frameworks, I think I might be a bit wary about that because it then becomes a little bit too complicated and too complex for people to join. We tried to create something that was very simple and people could easily join. And then people who have resources, training resources and tools and funding could easily reach out to us without the plenty complexities and bureaucracy that integrating it with a government system might work. In terms of how you can join, we are opening for members early next year after our conference, which is the first physical gathering of young genomics enthusiasts across Africa. So after the conference, we're trying to restructure because now we've understood a number of things from our first year. We've now learned and we're trying to restructure. So once we're done restructuring, we will put out a call for members. Thank you.
Okay, great. Any other questions in the back there?
Hi, another question for Oliver. So I really liked how you reduced all the hallucinations. Did you analyse the different sections where you got the answers from in the paper?
Thank you for the question. Which, I don't think I'm understanding it properly. Are you asking?
Yeah, so did you look, was the results, were it in the results and discussion?
Yeah.
Or was it in the introduction?
So when I extracted the text from all of the papers, so what happens is I separated each paper by section. So abstract gets its own text, introduction gets its own text, and then each line is given metadata. So it says it's from this article, this. So, and then those rows get put into the file. I don't know if that makes, into the data set. I don't know if that answers.
Partially.
So
okay. Thanks. That's late.
Okay, one last question before we go for the coffee break. Yep.
Good afternoon. My name is Tony from UCT. Thanks to all the speakers. I have two questions. First question to Professor Nikki Mulder. Once you have implemented these training curriculum to different institutions or individuals on the continent, is there a fair and great feedback mechanism for individuals or institutions to give criticism or feedbacks to the custodians of the curriculum to keep them updated, to keep the context relevant, and for them to be periodically reviewed? And then the second question to Oliver, when you talk about the LLM, when you sort of feed your AI the journal articles, do you need to get permission from the publishers or the journal articles themselves? I'm just thinking about it from a legal and ethical point of view, because I'm assuming you don't want to be sued for like $1 million for using training data. Thank you.
Okay, Nikki, do you want to start?
Yeah, so I think when people take the curriculum and use it, there are 3 types of feedback we want to get. We want to get evaluations from the actual students who did the course to see, well, you know, did it address their needs? Do they have the skills that they want? The second is from trainers to say, is it what they would have taught? Or is, you know, were there gaps maybe that they would have taught that's specific to their local context, for example? And then the third might be from the employers to say, are the people who've been on that course that are in my staff, do they have the skills that they need? So we're hoping that all of those different audiences will feed back, and that, you know, it's a community effort. It's never a done deal because the field moves, everything changes. So we're hoping that it'll be just a continuous feedback, and we can improve through that feedback.
So all of the articles that I gathered, they are open access articles, and the licensing around that is that you can use certain ones for commercial use and then certain ones for not commercial use, and I have that all within the metadata. So right now it's mainly what I've been doing is for my masters. So once that gets in, if this goes more commercial or goes onto the help desk for use in real life, I'm sure that would be a challenge that I'll have to properly, fully understand more. Yeah.
Okay. All right. Well, that concludes the workforce development session. So a big thank you again to the presenters. It's been really wonderful having you here.